Mic check, mic check. Morning Masters podcast. Y'all's made of course. Got a special guest across me. I got Dr. Michael Thomas Jr. How you doing?
Pretty good, man. Appreciate you having me, man. Thank you.
Thank you. I thank you, man. One thing I started by saying, I was telling somebody the other day, I said, some of my best guests have been from Thompson, bro. I don't know what it is about Thompson. It just,
Why you, that should be expected. Why would you expect anything less?
you sound just like somebody from
You know what I'm saying?
Thompson.
Like just because we're from the outskirts of what people consider the city, Augusta, whatever. I
Right.
mean, that doesn't necessarily mean anything. I think that we have an interesting perspective on life because of that, and I think it makes it where we are um, a bit, maybe sometimes misunderstood or maybe underestimated from some standpoint, but I think it makes our experiences through life a little bit different and maybe even a little bit better and maybe even enhanced because we get it from both
Yeah.
endpoints.
I can see that. I definitely think when I titled More Than the Masses, of course, and when I first started, I was thinking of Augusta and it just Augusta being more than the masses, but also Augusta is more than just Augusta. You got
Yeah.
your outskirts area, you got your
Right.
Thompsons, your Burke counties,
Right.
your Lincoln counties, stuff that's surrounding us. That also do great things and
Right.
have their own kind of city within a city.
Right. Exactly.
So yeah, I agree. Clap it up for Thompson one time. You know what I'm saying? Good clap for Thompson. But I think about even from the way back, I had Tiana from the Cookie Palace. She do something. She in Augusta, no. She probably got a big family out there in Thompson. Then I think about your sister. I think about Von Tego. I think about people I've done from Thompson. It's like it's not just the episode be great, but it'd be the amount of support that Thompson gives Thompson, if that makes sense.
Of course.
So I like that as well. Before I get into where you're from, but I know I said doctor, so you are a dentist, right?
Yes. Yes.
Just kind of talk to me a little bit about. We'll get into it later on in episode 2, but talk to me a little about what you do as far as at Marietta Smile Gallery.
So this is my office. I'm the owner. I'm the only doctor here. We do pretty much almost everything from a cosmetic standpoint, from a restorative standpoint, and even preventative as well. So when we talk about cosmetics, veneers, implants, anything in the aesthetic area, anything in the smile zone, Invisalign, those type of things, restorative wise, fillings, crowns, even root canals. I will do wisdom teeth extractions as well, and then preventative, your normal cleanings, deep cleaning, that kind of thing. And then we try to approach patients from a holistic point of view, meaning not holistic like HOL, but like whole like WHOL,
Got you.
like the whole mouth. What's going on with you as far as health wise? How is high blood pressure affecting you? Some of the medications that you're taking. A lot of times I see patients that are taking these different medications that may be affecting their gums as well. So I get with the patient, get with their primary care doctor and say, okay, this medication is causing this person to have gingival inflammation or gingival enlargement. So can we change this blood pressure medication? A lot of times it's like calcium channel blockers and that kind of thing. So we look at it from a holistic point of view. Some patients have what we call like TMJ issues, and they don't know why. It's causing headaches. It's causing neck pain, head pain.
TMJ. What does that mean?
Temporal mandibular joint.
You gonna go with TMJ. You gonna go with TMJ.
So
that threw me
there's
off.
basically a joint here that allows that the mandible, which is the lower jaw, kind of acts as a access point off. So it rotates. So for example, if my hand is the lower jaw, there's a little access point where the jaw inserts here, and that's what helps it open. But sometimes some patients, they have joint issues where it may be arthritic, so the jawbone may be rubbing on the bone of the skull, and that may cause some friction and inflammation. And a lot of times patients don't know where that pain is coming from, why they're having headaches, why they're having migraines. So all those things are related, from high blood pressure to headaches and all these different things. A lot of it starts in the mouth.
Wow.
And a lot of it starts with what you're ingesting and taking and eating. And some of those things you may not necessarily be aware of. So when I say we are a whole, that's kind of how I examine my patients and want to take care of them. Because at the end of the day, you want your patients to be comfortable and you want them to be happy.
Right.
And then you don't want them to have pain or any kind of issues where they feel like they're unsolved. So you want to try to help them achieve that. And even if that's something that I can't do, I can help you find or refer out to a different specialist to help you kind of figure those things out.
I can't say that from a patient standpoint. It's nothing. It's something worse, but it's not too much worse than going to a dentist and leaving like I don't know what's wrong still. Like
Right.
I still don't know
Right.
what they told me.
Right.
I know I got seen, but that
Right.
was it. You know.
Right.
So I want to clap it up for you one more time. You know, you did a great job explaining. You know, I like that. I like that. So I want to get into a little about your background, just who you are, you know, as a person. So, no surprise, obviously, I had your sister on. You know,
Right. Right.
I
Right.
knew when she mentioned you and she mentioned Denzel, it didn't click at first,
Okay.
and then I talked to somebody else and they mentioned you. I said, hold on, let me go check them out. And I think you shared something or you must have liked something. I went to the past. Oh, he a dentist, not one of those other. You know, I was like, okay, this is for
Yeah,
real,
not
for
a
real.
veneer tech, none of that other stuff. You know what I'm saying? I really went to school. I really got a BS degree. I
Right,
really got
right.
a DMD degree. In fact, a lot of people don't know, but um, I did a residency program as well in New York. I know it's a little bit fast forward from what maybe you were asking, but I did a residency program right after dental school in New York at Bronx Lebanon Hospital. And that was actually one of I feel like in my life, I've had several different moments that kind of helped get me to where I am, and probably were really, really pivotal of my experiences and that kind of thing. And I think that was probably one of them. So after dental school, I went to New York to do what we call a general practice residency. So a lot of people call it GPR, but basically it's an opportunity for you after you complete dental school to to go to a program, whether that's at your school that you're already at or another institution, a hospital, whatever, and get some basically get some extra reps in. And in that, it's not only just about school and training, it's more so of being exposed to different things. So like in my GPR, as you know from being in New York, I was in the Bronx. So as a GPR trainee or dental student, what you would say, I was on call.
Mm,
So throughout the year, or week, I may be on call 2 to 3 times a week. And what you do on call is during the day, you go to the clinic, you see patients, you diagnose, you do treatment. But then at night, from 8 p.m. to 8 a.m., you're on call. So anything that comes through the hospital above the neck, you got to go see it,
mm,
And in the Bronx, the gang related activity, people getting beat up in the subway or
yeah.
different accidents happening. So anything above the head and neck, you got to go see. And that kind of exposed me to a lot of emergency situations, and just exposed me to a lot of things that you may not normally see, just to get some experience on it. And then not only that, it kind of exposed me to some cosmetic areas of dentistry as
Right,
well.
right.
So like in New York, there's a really world renowned dentist up there named Dr. Larry Rosenthal. He's been there like 40, 50 years or whatever, but a lot of people give him credit as far as kind of using veneers to enhance people and kind of help and all that kind of stuff like that. But then he has a partner named Dr. Michael Appa up there as well that I got exposure to as far as veneers, dental photography, and that kind of thing. And, went to some courses there, and that really opened my eyes to things beyond just general and family dentistry. And that really is kind of what started me on that journey. So now, based on that exposure, now I got two cameras now. I got a studio now. I diagnose and I take pictures and photos of patients. I take small videos of patients to help the lab make the veneers so that the teeth look great and that the lab can kind of visualize how the person talks, so they can see how, when they talk, their teeth touch their lip line and all this other stuff like that. But it was basically from that exposure. Um, so yeah.
No, I like that. I think it goes into maybe why you're so detailed and even why you've been so great here doing what you do. seeing it in one place somewhere else and bringing it to another place that you plan to do your practice at. So I think that's amazing. But you mentioned two cameras. What's the difference in having two and one? Like besides the quantity, of course. Like why two?
Well, I have 2 mainly because not only do I take the photos, but my team, they take the photos as well. So, just so we can be efficient, nobody's waiting on somebody else to take pictures or photos. We can get the pictures and photos, whenever we need them, and, it's just more so of being efficient. But in order to get the 2, I had to go ahead and invest in the 1. So, you had to invest in yourself and kinda
Yeah.
see beyond the forest to kinda get to where you wanna go.
Got you. Okay.
Mhm.
I like and then like I said, even being up there in New York, I'm sure it's definitely weather change for you
Yeah, yeah, for
from
sure.
being
Yeah,
down.
I ain't never going. I'll go back to visit, you know what I'm saying, but I ain't going to like to live or nothing like that. Nah, 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 nah.
And,
In fact, man, like it's looking back on it. I remember my dad was like, "Well, why you going to? You know what I'm saying? Like, why you going to New York? You already like you a dentist. Like, you graduating in May. Like, why you going to New York? Why you feel the need to go up there?" And I told him, I said, "Well, the only thing I know is dentistry here in Georgia or what they taught me in school. I don't know anything beyond that." So I said, "Well," and I've never lived anywhere beyond Augusta. So I'm from Thompson. I went to Payne College, and then I went across the street to MCG for dental school. So my whole life has been in this,
same
you
area.
know what I'm saying, this same area, this, 30-mile radius, I guess you could say. Um, so I wanted to go up there for exposure and just, just to see something different. Not necessarily like, wild out or anything like that.
Yeah.
It was more of a educational enlightenment experience.
Yeah, yeah, and that I guess too, like when you come out of your environment that you're normally used to, I think it's just the experience part as well, like just experiencing, even the trauma stuff you've seen there, as far as like people coming in with whether it's bruises from getting beat up, stab wounds, gang violence,
Yeah.
fall, whatever,
Right.
seeing that stuff that you probably won't see here,
Yeah, nah.
um, to that magnitude,
Right, right,
and on a daily basis or weekly
right,
basis. So now you're comfortable with it. So when you do see it here, it's like, hey, I got the experience in this department. I
right,
can
right.
tell you something about that. So yeah, that's dope, man. This is a real dentist here, man. First 12 minutes about straight dentistry. I like that, man. Clap it up for you, man. But yeah, so just kind of getting the backstory to you. You are the oldest, correct?
Yes. Yeah, I'm the oldest.
Okay. So talk about that. Just your family dynamic just coming up in Thompson, Georgia. Tell me about what Thompson. What's that like for you?
Okay. So in Thompson, for the most part, it's one high school, one middle school. Pretty much everybody knows everybody. Um, my dad's the head basketball coach there, for the high school varsity team, and he's been that for, I think he's going into his 43rd or 44th season. And
Before
then
you
my
was born.
Yeah, yeah, and
Wow,
then my
it's a long time.
mom, she's they've been married 40 plus years. And she's been the rock. She's been there from the beginning. And then I'm the oldest. My sister's the youngest. It's just 2 of us. Um, so upbringing in Thompson to me, I felt like was great. Um, in some ways, there are some things, being a coach's son that you get privy to, which are great, and then there's some things that, um, maybe aren't so great. But I think that's what makes me, or gives you an opportunity to grow from it and perhaps have a different perspective.
Right.
So, like being a coach's son, I think sometimes there's some level of expectation of like maybe you should be good or just talented or whatever. You should just be in the gym all day or something like that.
Yeah. A gym
Um,
rat.
yeah, which some kids are like that. You know what I'm saying? Some kids are like that. And when I was younger, in some ways, I was like that. Like I wanted to go to the gym every day with my dad. I wanted to go to every game. I wanted to go to every practice. I wanted to go to every summer league game. Um, I remember growing up, and some days I'm waking up at 6 a.m. because I'm trying to go too. Like I'm trying to go. Like they got summer league games in Millersville and Baldwin, and I want to go see the team play because they're going to go play, Gerald Riley from Baldwin in the summer league game. And Gerald Riley went to
Yeah,
like
yeah. Yep.
Georgetown or whatever, or whomever it may be. So, um, from that perspective, you know, I was in some ways a gym rat as well, but I think because my dad is a coach, and I think because he knows that basketball is a way to help you get where you want, but sometimes that might not be everybody's sole way. I think he instilled in me to think beyond basketball.
Mm.
And not only him, I think guys like Montego Cummins and Antron Lee as well. Because like when they would come back to the city to help him do his camps and stuff, when they talk to the kids at the end of the camp, that's one thing that they will mention. Montego always talks about don't let basketball use you. Use basketball to help you get where you want to go. Now,
Mm.
as a kid, when you 7, 8, 9, you're like, man, no, I'm going to the league just like you, bro. You know what I'm saying? But as you get older and you mature, then you kind of understand what he's saying and what he's talking about. So I've always loved basketball. I've always wanted to play basketball. I've always thought that it would be something that I would do for a long time. But I think around like 14, 15, 16, I started to have other interests. And I think what kind of tapped into that was like middle school and high school, like I was in like these college, like high level college classes, and they were hard. And I was smart. I feel like I was, you know what I'm saying? I was smart and I worked hard, but they were really, really hard. And I said, well, if I want to do something beyond basketball, I got to get this stuff. And I think it kind of led me to really looking and thinking about life beyond basketball. And that's kind of how I got into dentistry. In fact, that was one of the reasons why I kind of stopped playing football. So I played football 8th grade, 9th grade, but then going into my 10th grade year, 9th grade was so hard. Now I made A's and stuff, but I had to work my ass off to do that. Like stand up to 12 and 1 o'clock to like do work and do graphic organizers and all that crazy stuff. Um, but going into 10th grade, I felt like, okay, I think I want to be a dentist. What I got to do to be a dentist? And
Mm.
start doing research and talking to people and stuff. And I said, well, I can't be at football practice from 4 to 9 p.m. every night with Coach Welch. I got to figure like this whole academic thing out. So um, that's kind of what gave me some decisions to make as far as
So,
that.
so just curious, you didn't like plan when you were younger, like I want to be a basketball player. I mean, a dentist. It wasn't like a thing when you were 6, 7, 8. It just
Nah, it,
came about
it
later on in life.
later on, like 14, 15,
But
16.
was it just classes and you being smart and you feeling like that was the way, or it was something you saw? Like what you think like pulled you in to dentistry?
I would say initially I knew it. I was thinking lawyer, OBGYN, and then I kind of stumbled upon dentistry. So in 9th grade, I took a class called Health Occupation with a young lady. At the time, her name was Miss Thomas. I think she had a nursing background or whatever, but she was a health occupation teacher. And at the beginning of the year, she gave us she had like a couple books in her class, but basically in the book, it outlined all the healthcare professionals, their um, what type of schooling they needed in order to be that, how long it took, how much money they made, how much training they need, and what was the need for that profession in different socioeconomic areas and that kind of thing like that. So initially, I wanted to do OBGYN. And then after that, I was looking at maybe a cardiologist,
Hmm.
and then I stumbled upon dentistry. Now, in the health occupation class, you get an opportunity to shadow different healthcare providers in the city of Thompson. So we didn't necessarily like have like a cardiologist, but I did shadow like um, a radiologist and some other healthcare fields, and then I stumbled upon dentistry. So Dr. Picard, who's a dentist in Thompson, I guess he had some kind of relationship with the school, so he allowed me to come do my health occupation class shadowing with him. And then that's kind of how I got got hip to dentistry.
Okay.
And not only that, at the time, this is like 2001 or so, I had a cousin in dental school. He had just finished in 1999. Now, he was a lot older than me, but it was still another kind of signal that, hey, this might be possible. This might be something that you can do. Um, so he finished in like 99. I started shadowing in like 2001, 2002, whenever that was. And then that shadowing opportunity became basically a job. He like what's it? I asked him, I remember we were going into like summer basketball. I said, hey, Dr. Picard, we about to end school. Um, I'll try to come, as much as I can, but during summer basketball, there's gonna be some days that I'm gonna be here and not because of camp and this and that, whatever. He said, okay, just come when you can. So that's what I did. I came consistently every time that I could. And then after that, he asked me, okay, do you want to just work here after school? I was like, okay.
I know,
At the
right?
time, 525, I was like, okay, if I work a couple shifts here, I mean, I can go get something from Zaxby's, you know what I'm saying? So that's the only thing I'm thinking about. I can
Welcome to the
I
More
can
Than
buy my
Matches
little
podcast
girlfriend,
by
a little
Mike
something,
Brooke
something, but or
and
go to the
Baby.
movies or whatever. So that's kind of how I looked at it. And then not only was it an opportunity for me to make money, but I learned a lot from him. Now at the time, obviously 525 is not a lot, but to me at the time it was because
In that day and age, you can get a
yeah,
lot. Zaxby's
yeah,
was way cheaper back
yeah,
then.
yeah. I mean, anything, school clothes. You save it up. Put in a little account here, and then you can get you some shoes or whatever the case may be. So I think that was a great opportunity for me.
Yeah. How important? And I know I'm going back a little bit, but how important was it? Like the thing that your father, your mother installed in you, to even give you that wherewithal when you're going out in this world to like, okay, well maybe basketball don't have to be everything, or
Right.
I need to utilize my resources and build these relationships with doctors or people I'm shadowing.
Right. I think it was vitally important, and I think maybe because my dad, had been in coaching so long, he's seen so many, student athletes not take the student part serious. Um, he really emphasized that to me. And I think one thing that I really appreciate him for is when we were growing up, third, fourth, fifth grade in the summertime, he would like make us read like all the time. Like he would make us read the Augusta Chronicle like every day during the summer. And not only just like read it, but like we would have to well, at least I did. I don't remember what Kayla had to do, but I had to read something other than the sports section. It had to be either business or like the money part or just whatever the news is. Read it and then write it down, like rewrite a summary of it. And I think from that standpoint, I think he knew that reading was so important, not only because not just for you to be able to read, but really be able to read and understand, because I think he understood the standardized test part. The standardized test part, meaning SATs, dental exams or medical exams or whatever kind of exam that you're going to take later on in life. The most important part is really being able to read and comprehend what you're reading.
Yeah.
Because if you can't read it and comprehend it, then how are you going to get the answer correct? Whether that's on the reasoning part, the quantitative reasoning part, the math, or whatever the case may be. If you don't really know exactly what you're reading and understand what you're reading, I don't think you'll be able to successfully answer the questions right.
I agree. I also you mentioned you was like you stopped playing football going into 10th grade. Did you stop playing basketball?
No. I kept playing basketball.
So I had to ask this question because obviously your dad coach. Like, what made you pick one over the other?
That ain't really a hard question to answer. You want me to tell you why?
Yeah.
Because so around that time, we had Coach Welch there. So the position I played was receiver, or what they call split end, or whatever they call it. So we ain't passed the ball. So it ain't like I'm out there catching the ball. It ain't like they throwing the ball to me. You know what I'm saying?
Yeah.
Whether, on JV or whatever, like, we not passing the ball anyway.
You just getting cardio in.
All I'm doing is blocking. So I'm out here from 4 p.m. to basically 9 o'clock, by the time you get undressed and you get home, I ain't even catching the ball. I'm blocking every day.
Yeah.
And not only am I blocking every day, there's moments when I'm on the scout team and I got to go reenact what the other team is doing.
Oh, yeah.
So sometimes
yeah.
not only am I, blocking like the cornerback or whatever, I got to go crack back on Danny Verdun Wheeler or Jap and Casper Brinkley. No, I don't want no parts of that. You know who those guys are?
I don't.
They played in the NFL.
Though.
They played at Georgia and University of South Carolina.
Okay.
They 6'2", 240, 6'2", 250, 6'3", 250. Played in NFL.
That's a workout.
Yeah.
That's a workout.
I'm in 9th grade. I'm like a buck 130.
You about to say you probably small
no. And they know the play. They know the play. They,
Yeah.
You know what I'm saying? They studying the play, so they know what the other team running. So they know I'm trying to crack back on them.
Yep.
They're not letting that happen. I'm getting cracked on.
You said you got tired of that.
Nah, man.
He said, I'm gonna just study, man. Look, I ain't
Like
got time.
you know what I'm saying? Like, and they didn't need me. They gonna win anyway.
Right,
you know what I'm
right.
saying? What impact am I gonna make? Now, the only time I really seriously thought about it was when my class became seniors. And I think we lost. I think we ended up winning our region, but I think we got upset in the first round against Westover. And I was thinking, man, not that I would have necessarily made a great impact or something like that on that season, but just maybe me and some of the other guys that started, maybe we would have kept going and finished through with that class. Maybe
Yeah.
what could that class have been? Because we still had a good, a great team. They won region probably every year, you know what I'm saying, until more recently when it's been a little bit more competitive with Burke County and stuff like that. But
I see. I just beat him the other day.
yeah.
Look at yo, Thompson.
And Bailey. Right.
When I was in school, Burke County really wasn't a challenge.
Right.
Basketball or football. But now, they've always been good and stuff like that because they're one of the few teams in the CSRA that actually care about football.
Mm-hmm.
And they really push for football. But no, Burke County's a good school.
That's funny you mentioned that. Oh, but yeah, but in basketball, like when I did talk to Vontico and he spoke super highly of your dad. Did you think could that have been an option for you? Do you think if you say I don't want to play in high school, could you just not have played? Or how good were you?
I don't think that was really an option because I love basketball. That was something that I grew up loving. And as far as like, I think so on my team, 2000, like my senior team, 2005, we ended up winning the region that year. And that was the first time we had won region since, I think, Vontico's junior year. So that was basically like 94 to 2005, which for us, because of the run we had in the 80s, and then with, Chris Norris and Vontico and them, and Antron Lee, that was a big drought.
Yeah.
From like 93, 94 to 2005. That's a long
decade.
time.
It's a decade.
That's a decade. So we ended up winning region that year.
Who y'all play? Who y'all beat?
We beat Glen Hills.
What?
So actually, this is what actually happened. If I'm not mistaken, Glen Hills ended up upsetting Butler in the semifinal.
Hey, chill. Not too loud about Butler.
So they had, I think the guy named was Antonio Keller or Kelly.
Tony Keller.
Yeah. He was really, really good.
Defensive,
and then Jarrell Stevenson, he was a freshman on that team. I think he was a freshman.
Yeah, he was,
on that
yeah.
team. Yeah, he was a really good freshman. Really good. He's 6'2", 6'3". He can go left. He can pull up. He can.
A lot of people don't know about, like, they see him now because of the alumni games. I had to tell somebody the other day. They was like, I said his IQ.
He went D1.
His IQ was insane.
Yeah,
even at a young age.
Yeah, he's a zone destroyer because he can get at that high post and do a lot of different things. But in high school, I felt like I was pretty good, but like I didn't really. around like my sophomore and junior year, I really got into the books, man. So like I really wasn't like a gym rat like that. And for the most part, I didn't really shoot on our team. I just got everybody in position.
You play point guard?
I played point guard.
Okay.
We had a lot of people. We had like 6 guys on our team from Thompson go play college basketball, which is like unheard of. We had one guy go to Savannah State, one guy went to Morehouse, a couple other guys went to like JUCOs or like smaller schools. We had one guy walk on to Payne College. So we had a really good team for a small city school. You know what I'm saying?
Yeah.
A small town school. So we had some really good players. We had some really good players.
So I always say like people, story is history, and like you kind of blend things together. So it's funny hearing you talk about 05 and how good y'all won region and all this stuff, right? And I think of the first time I seen Thompson, and it was 06.
Okay.
So it's like you wasn't there. So
Yeah.
clap it up for you for not being there. What I'm about to talk about.
That
Right.
team was young.
We gonna say that. It was a
That team
bad,
was young.
that was a bad day for that team, but
So my senior team, we had like 9 seniors.
I was about to say that. So y'all was so good the year before.
Yeah, we had like
I feel like
10.
teams were playing y'all and also wanting revenge because
Yeah.
if you a junior, you don't care. Like
Yeah,
they beat
yeah,
us
yeah,
last year. Whether
yeah.
them seniors here,
Yeah.
freshmen there, I want blood from that team.
Yeah. Yeah.
You know, and I didn't realize that that Butler team was also really good. They won.
Yeah.
They went far in state.
Right.
And yeah, we went to Thompson. I'm not from here. So I'm not knowing. I'm just I'm playing JV. We played.
Yeah.
We won. I was
Yeah.
like, fine with
Yeah.
us, right? I'm watching the boys and like, it's like the score is just insane.
Yeah.
It's super bad.
Mhm.
People was leaving,
Yeah.
and then my cousin he did a dunk, like it's a fast break.
Yeah.
He bounces the ball from on the ground high, and he's like 5'10". Tron Carter, you probably know him because you played. And he cocked it back because he was so sure he had to go back and get it.
Mhm.
And 2 people fouled him, and he dunked it on them.
Okay.
And the whole gym went crazy, and like people from the Thompson side just said they just left and went home. And now my introduction to like Thompson for one, but also
Yeah.
like, oh, these guys are good this year.
Yeah.
You know, so it's funny like how I ran into it, and then hearing you saying like,
Yeah.
hey, if you just came 10 months
10
earlier,
months earlier,
you would have thought
been
different of
totally
us.
different. Yeah.
So, but also Thompson was only bad that year.
Yeah.
After that, I seen them win game. But my
Yeah.
mom was like, oh, this team is horrible. You know how that goes.
Yeah.
You're like,
Mhm.
this team
Yeah.
horrible.
Yeah.
But then talking to y'all and then talking to Montego, I'm like, oh, well, hold on, Thompson they got a name. They really got a name out here. I just didn't know that.
You're right.
So my introduction, now I don't know about football, so I didn't really pay attention to that. But now hearing about it and hearing people talking about it, I know the heritage and how successful y'all have been in sports, among other things.
Right.
So yeah, I think that's dope. So talk a little bit about like kind of like leaving school. So you're done with ball at this point. Like your senior year, you know you're not playing college ball. You are
Right.
playing college ball.
Well, actually, man, I wanted to go to Morehouse. My whole focus, because like I said, like 9th, 10th, 11th grade, I'm thinking more academic. I'm
Mhm.
thinking about something beyond basketball. Now, I wanted to play at the college level, but more so play so it can pay for school, so
Right,
I can
right.
get to my ultimate goal.
Using basketball, not letting you use you.
Right. So my goal was, okay, let me go play basketball, let it pay for school. In the meantime, I'm gonna be, trying to apply and get into dental school. So our senior year, took my SATs and all that. I graduated, I think, with like a 3.5 GPA and all that kind of stuff like that.
You gotta clap that up. You can't just say it like that and just kind of brush past it, man. That's the big deal.
I think I was like top 20 in my class, but mind you, I'm the only black guy near the top 20.
Come on, man.
You know what I'm saying?
Come on, man.
So all my college high school classes that I'm in, I'm like the only black guy in there. I think there was a time when maybe it was myself and maybe another guy, but I don't think he was in my class. I think we were like in the alternating classes or whatever the case may be. But like pretty much only black guy beyond one other person. And my goal was to go to Morehouse. So my goal was to maybe either walk on at Morehouse or get a scholarship there, play basketball, but allow the basketball to pay for school. So my dad and I, we went to Morehouse for a visit, and I I think it was in March, like right after the state tournament and all that stuff had ended. Now, mind you, this is 2005. I'm 18. Some of these things, I'm gonna paint the picture now. So some of these things I haven't necessarily been exposed to yet or has actually seen.
Right.
So we get to Morehouse. The first thing we do, we go on a tour with with one of the gentlemen there or whatever. So now, me coming from Thompson, not really seeing anything beyond that, our tour guide, he was a little different. So as a young man, I'm like, I never seen it like that. You know what I mean? So it was just different for me. So we did our tour, whatever the case may be. Then we met with the head basketball coach. I don't even remember his name right now, but basically, he told me in so many words. He got 2 or 3 point guards coming back for the following season. The only thing they can do is maybe you walk on, and then academically, they were saying the only thing they can do is like a partial scholarship. Now, mind you, partial scholarship, that don't necessarily mean half of the tuition. It might just mean, a third of
$2,500.
it,
Yeah,
25. You know what I'm saying? So basically, the money didn't make sense because in my mind, I'm going to dental school anyway. That's going to be $30,000 to $40,000 a semester already.
Yeah.
So I'm just thinking about the math. When I get out of dental school, that's going to be, at the time, 2005, like 160 to 180, basically $200,000 that you in debt, not counting undergrad.
Mm-hmm.
So I'm like, okay, let me just recalculate some things and figure it out. And then my dad, he knows, a lot of people at Payne College, Coach Spry, and a lot of different people. Based on my grades, my SATs, and all this other stuff like that, they gave me a full presidential scholarship. Now, at the time when he said, I think you should go to Payne, I was like, nah, I ain't going to Payne. But that ain't no slight against
No, I
Payne.
got
It's just
you.
like, I'm saying I want to go somewhere different.
Real quick, and I 100% understand what you're saying, and I think even listen to your sister, anybody that I've talked to about college, it's like when you're from here and this is all you know, naturally you're like, look, I want to get out of here for a little bit and
Right.
experience
Something
these next
different.
4 years, this
Yeah.
phase of my life in a new environment.
Right.
I'm not the pain,
Right.
AU,
Right.
nothing. It's just like I've been here 1,000 times.
Right.
I know what it's like. I know
Right.
where to eat at. I want to
Yeah.
learn new things and meet new people.
Yeah.
So I understand it.
Yeah. And I had been to 100 Payne College games because like I said, my dad is like really good friends with Coach Spry. So we would go up there to catch a game. We would go up there like in our preseason like workouts or whatever. Instead of like, okay, maybe we don't do practice today, we're gonna go see Payne play their first like preseason exhibition
Right,
game
right.
or something like that. So I had been to Payne like a lot. But looking back on it, it's probably the best decision I ever made, man. And that goes to show sometimes, like as a kid, you don't know everything, but your parents know more than you do. And what seems to be something that's not like for you, sometimes really is for you.
Right, right.
To me, Payne College was my best experience, hands down, and it shaped me more than anything.
I want to clap it up for Payne because they get a lot of flack. They get joked on a lot as well because I guess it's local. It's just the area.
Right.
But I do think people that I know have went there and are successful
Yeah.
always say they love the experience at Payne.
Right.
I haven't had somebody that is successful that finished to tell me they didn't like Payne.
Right. Right. Yeah. And in fact, my wife went to Payne.
Clap it up for your wife too, man. Why not? Right.
Right.
That's what's up.
My wife is she's also from Thompson. And
Look at that.
this is not to get off topic, but she's also from Thompson. So we were always just friends and cool or whatever like that. And then she basically had the same experience. Her goal was to go to Georgia State. For whatever reason, her GPA and stuff was higher than mine. Like I think she's like top 10 in the class. But for whatever reason, like Georgia State like deferred her or something like that. I don't know if they got her application mixed up with somebody else's or what, but I remember she told me, I was like
that.
how you not getting into Georgia State? Like,
Yeah.
but anyway, she ended up going to Payne and getting a presidential scholarship as well. She did 2 years there to get her requirements for nursing school, and after that, she went to MCG for nursing, and then after that, she went to FAMU for nurse practitioner school. So Payne is very well, celebrated and respected in our household for sure.
I like that.
Yeah.
On top of that, it's HBCU too. So
Yeah.
clap it up for them for
Yeah.
HBCU. I'd like that. When I was younger, I would say that, like, talking to you and people that have been to Payne. So I understand when you're saying, like, you
Yeah.
wouldn't think about Payne.
Right.
But even in schools, that wasn't something. None of my guidance counselor was like, "Hey, you should go to Payne."
Mm-hmm.
Now, granted, I went to Butler, and it
Right.
wasn't us in there,
Right.
but that was never an option.
Right.
Never gave me an application for it, nothing. It was always AU or somewhere else.
Right,
They even
right,
said
right.
GMC before they said Payne. They
Yeah.
just didn't mention
Yeah.
Payne. So
Yeah.
I understand it. So I always try to give them the credit when I can give them their credit.
Mm-hmm. Man, in fact, man, like I'm not gonna say like when I was telling people I was going to Payne College, I remember at 18 and 19, I remember people giving me this look like, why? You know what I mean?
Nah, I
like,
feel it.
what's really going on? Like, I thought you were smart. You
Yo,
know what I'm saying? Or something
Hey,
like
what's
that.
really going on is crazy.
But I have no idea. I mean, I'll just say this, man. It was the best experience ever. And the thing about Payne College to me that made it so special was when the counselors or whomever are there really see that you're like somebody that's really trying to get it, they gonna push you. They're gonna give you every scholarship opportunity.
Yeah.
They're gonna give you every research opportunity or whatever the case may be to help excel you to whatever you're trying to be in your career.
I want to
So,
say, it's also what you make it. You know what I'm
Yeah.
saying? College, what you make it. So
Yep.
I watch it, listen to you talk. It's very much well, it seems like even since at a young age, you knew how to utilize your resources. You knew how to speak to people, build relationships. And I
yeah,
think that's something that you learn in college most times,
Right,
but you
yeah.
kind of already had that.
yeah,
So I'm pretty sure that propelled you even in college. Whereas some of us, we don't speak, especially depending where you come from. You like, I ain't talking, I don't know.
but you
But
know
you
what?
weren't like that.
In high school, I ain't talk.
You didn't?
No,
Oh, we twins.
I was like, I was to myself, quiet, chill. I was just, I don't know. I really didn't talk much. I kind of just, played basketball and did my work. That's pretty much what I did. Like I wasn't out with some of my other friends. Their parents let them out. They go to all these parties and stuff like that. I was in the house, and I was content with that. That's what I like to do.
Yeah.
Like I would sit all day Saturday and watch college football and like just do my work. Um, but in college, I think I realized one to get in dental school, you have to have a certain kind of. They want a real well-rounded student.
Mhm.
They don't want like a nerd, and I understand that because as a dentist, you have to talk to people. Like you can't just be like you just go in the room and do the work and then you leave. No, you have to build a rapport. You have to talk to people. You have to build relationships. And I think that's why to get into dental school, they want more of a well-rounded individual. So because I knew that based on the research that I did, in undergrad, I began to kind of tap into that more. So like at Payne College, I was a freshman class president. And then I was a senior class president as well. I was like the French club president. I mean, I did like a lot of different things. I pledged Kappa.
Hey, don't skip over that now. Come on now. Come on. He tried to skip real quick. What's that like? I went to college, but I was still like I was in high school. I don't want to talk to nobody. I'm just here to do work and go home. If that. What's that like? What went into you wanting to pledge and like how was that? Was that? I see the movies, so I don't know how it is in real life.
Yeah.
You're the first person I've asked this question.
Pledging like the best thing ever, man. Especially if you pledge the right fraternity, especially Kappa Alpha Psi Fraternity Incorporated. If you pledge Kappa Alpha Psi Fraternity Incorporated on any campus in America, it's gonna be the best decision you ever made, hands down. And
Clap it up for y'all. Clap it up for y'all. Why not? He said it so beautifully. I can't, can't skip over that.
I think it's mainly because Kappa just exudes, professionalism, being someone profound, being, smooth. And that is not necessarily just all dealing with like girls and stuff like that, but just being a smooth operator and getting your work done. Business before pleasure, before anything else. And that is something that is I think paved the road for me as well as far as like developing who I am.
Mm-hmm.
Like you said, college, is that point in life where you're a little bit away from home, you get some freedom, but you still gotta rely on some of those principles that you had before. But then you're also gonna pick up new principles as
Right,
well.
right.
And I think Kappa was that for me as well. Now, still with Kappa, I didn't pledge until my senior year because, like I said, I'm trying to get a dental school. So I laid the foundation freshman year, sophomore year, and junior year to get my GPA. Like in college, I think my GPA was like a 3.97 before I pledged.
Jeez. You just got smarter, didn't you? You got smarter.
I mean,
But you was locked in.
I was locked in. Like I knew what I wanted to do. So, and that's what I did. So I said once I got to where I would have a little bit more free time as far as my school and studies, I'm gonna go ahead and pledge Kappa. And I think it was another one of the best decisions I ever made.
I like that. I like that. So I know you mentioned, obviously Payne was your best experience, and is that where you and your wife began to talk, or y'all still were just friends?
Actually, no. We didn't. We were just friends the whole time. I mean, let her tell it. I was probably dating somebody I shouldn't have been dating, and the same with her. She probably dates. You know what I'm saying? You know how it go. Like you friends and you cool. Like Michael, why you talking to nigga? Why you talking? why you talking to this dude? You know what I'm saying?
Yeah, I like that. That's
But
funny.
we were always friends and everything. But then like when I was in dental school, she was a nurse practitioner in school. We ended up kind of connecting on a different level, and that kind of what led to it.
That's dope, man. So talk about like, because how does it work? I'm not a dentist. I don't know. After you finish college, do you go straight to dental school after that, or you have to do something else before dental school? Like, how's that transition?
So as long as you meet the requirements, you take the necessary, college credits for, the different health courses, whether it's anatomy and physiology or physics or biology and chemistry, organic chemistry and all that. You got to meet those requirements for those particular classes. Then you got to have a certain GPA that they're looking for. And then you got to have the standardized test scores.
Mm.
It's called the DAT, the Dental Aptitude Test. And you have those three components plus a great personal statement, references, letter recommendation, stuff like that. Then you can go into dental school. So you can go into dental school right after you complete your undergrad degree. So you can go, some people are 21 or 22, and then some people, they go into another career and then they come back and then they go into it. But as long as you complete those necessary requirements, you can go into dental school.
So talk about that. Talk about that a little bit. Like, what is dental school like? How long is it? How many years?
So dental school is 4 years.
4 more years of school.
Yeah, so 4 years of school. So 4 years of undergrad and then 4 years of dental school.
4 years of high school, 3 years of middle school, 5 years of man, that's a lot. That's a lot.
Man, you don't even count all that. Don't even count all that. So, now for me, you got to think about, okay, so I went to Thompson. Thompson at the time, pretty much mixed, like 50-50, white, black. Payne is like HBCU.
Mhm.
You know what I'm saying?
Fully.
We got Laffy Taffy playing in the cafeteria. You know what I'm saying?
05, but
You know
yeah,
what I'm
then
saying?
franchise
Like,
boys was out.
yeah. So, you got Jeezy, people
Yep.
pulling up with the Jeezy blasting and stuff like that. But then you go across the street, that's MCG.
Yeah.
So for me, it was definitely a different dynamic. It was a different dynamic going from Thompson High School, which is a mixed situation, white, black. Most of the teachers are white. Going to Payne, most of my teachers are black. Most of my contemporaries are black. A lot of them are from Atlanta, and the different influences of rap and all that, T.I. and all that during that time. And then they go to dental school, which is predominantly white, really all white. And then predominantly is all white.
Plus you.
Plus that, you know what I'm saying? So now it's just different.
Right.
So
right.
now, in my experience, I never experienced like blatant racism or nothing like that. I'll never like say any of that. However, you do feel like you do get the feeling that, okay, I'm the only one of the only few black people on campus. I mean, that's just what it is. Now, nobody ever made me feel, out of place. There was no blatant racism, like I said, or anything like that. But you're well aware, it's like me and my 3 black homeboys, and then like a couple black girls, and then everybody else white,
Yeah.
or they're Asian or Hispanic or something like that. But we probably, my class, we had 65 students, and I think during the time, I think we had like 11 people of like African descent, whether they were
Out of
all
65.
black or mixed or whatever like that. So that was like one of the most at that time. And several of my good friends, they went to HBCUs as well. So like Dr. Raymond Dickey, he went to Fort Valley. He's a Q-Dog. And then Dr. James Barron, he went to Hampton. He was a Sigma. And then Dr. Alex Harvey, he went to Georgia Southern. And then Dr. Thomas Suit, he went to West Georgia. So Alex and Thomas, they kind of already experienced that. But for me, Dr. Raymond and Dr. James, we like, you know what I'm saying? It's different, man.
Yeah.
You sitting in class, you sitting in your lab, everybody around you white, which ain't nothing wrong with that, but it's just a different experience. Because I'm used to being a little bit more mixed, and I have relationships with a lot of, white contemporaries, white friends, or whatever the case may be, but not in a situation where I'm surrounded by all,
Yeah.
you know what I'm saying? So it was just different.
Like where you turn it is right there.
Yeah. And it was just different, man. That's all. It was just different. But like I said, no like blatant racism and nothing like that. Now, the educational kind of requirements and standard were a lot higher because now at Payne, I had to study, but I ain't have to I studied a lot, but I didn't have to study like I had to study in dental school. Now, dental school, man, I studied like all day, every day. That's like all I did.
Mm.
And it was that's just what it required.
So in dental school, like I know you said lab, like what are y'all doing? Are y'all sitting there with paper and pen like how he is over here? Or is it like y'all got coats on, you're actually touching things, going to people's mouths? Like what did the school require?
So the first couple years at MCG, you're doing didactic work. So you're doing like paperwork. Basically, you're sitting in class, you're sitting in lecture, you're taking notes, and then you are getting tested on those. So it's biochem, it's anatomy, all those different things like that, and then you are being tested on it. As you progress through dental school, then you get into labs and that kind of thing like that. Now, the labs you take in your first couple years are not on patients. It's more so on you're doing what we call like a wax up. Basically, you're taking the ball of wax and then you forming it into a tooth. And they train you on how to do that and how to see that and how to have an eye for it. And you're doing a lot of things they're training your perception. They're training you how to look into somebody's mouth from upside down, but look into it in a mirror and kind of do what you need to do. And a lot of those
It's
things.
like what, situational, I guess?
Yeah. Yeah. You're doing a lot of those things like on a mannequin.
Gotcha.
You're doing a lot of those things on what we call a bench top. So maybe you have a desk here, but you're drilling into it like a fake tooth.
Yeah.
And you got to make the drill size a certain amount of millimeters or whatever the case may be. And then based on how perfect you drill into the tooth, then that's how you grade it.
Out of curiosity, how was it for you doing it that way? Like being tested on like the mannequin or trying to drill. Like how'd you fare during these processes?
The didactic part, like the classroom part, was more difficult. That was harder for me. That took me a while to get adjusted to, because how they have you thinking about how to answer the questions is a little bit different. So like in undergrad, whatever the question is, the answer is whatever the answer is going to be. Like there's no critical thinking really to it. Whereas in the didactic stuff, a lot of the questions were critical thinking questions. So you have to think beyond, okay, this blood type is this blood type and that kind of thing. It's a little bit more critical thinking because the questions are designed like they give you scenarios and you got to think through that process to get to the answer. Whereas the the lab portion where you're drilling out stuff, that was a lot easier for me because I can visualize and see a lot of things. I think really really well, like perceptual ability. Like my perceptual ability testing for to get into dental school was like a 24. And like the highest at the time you can get was like a 30, but like on that scale, the average for a dental school student trying to get into dental school was like a 20 or 21. So I scored like a 24. And that like helped me that probably helped push my application to the front because they're like, oh, this is a 24.
Yeah.
You know, on this young man coming from HBCU, whatever. So the perceptual ability part, the drilling part, to me was a lot easier.
Did you ever feel like? Because I want to stay on that topic just for a second. I know you said being one of the few black students. Did you ever feel like you were graded differently? Not racism now, but I'm saying like you better show me some like, or was
I
it
would
just
say yeah.
fair? Okay.
I would say yeah, because like I mean, when we do the exams, and I'm looking at my prep that I put in mine, and then I kind of glance after we get done and everybody get their stuff back, and I glance at somebody else, and I'm like, I might look a little bit better than her. I mean, I know her dad a doctor and all that, but I'm like, mine look better.
Right.
And not only did I feel that way, I had other friends that felt that way too. Now,
Right.
now some of the friends that felt that way, I'm like, bro, nah, your stuff don't look. But you know what I'm saying? Like, but the ones that were legitimate, we were in one accord where we felt that way. Well, someone like, bro, you just saying it just because you.
I know, right? Chill.
This ain't it. Don't even say nothing, bro, because you ain't even in that realm. Like, we seen your work before the test. We've been trying to help you. You know what I mean? Like, so.
But that's another question I do have while you're on the topic. When you go to dental school and you finished, and I'm pretty sure people, were there, you ain't got to name names, but people that just dropped off, like, it's too hard. I can't do it. Or did everybody just stay? Does everybody that committed, does that locked in?
In my class, nobody dropped out.
Wow, that's good.
Yeah, now I got some friends that I know from other schools. They did transition and do something else, but seem like they're still doing well and that kind of thing.
What's the hardest part about dental school, you think?
I think the hardest part about dental school is realizing that it's not undergrad anymore. And realizing all that stuff that people have been telling you all your life. Oh, you smart. And then getting into dental school and you getting your first C, or you getting your first D, or you getting a fail or something like that because maybe you thought about this in the wrong way. I think that's the hardest part. Really tapping into that this is not undergrad, like how you have to think about things. And I think probably the other thing would be is learning how to study. So in undergrad, you think you know how to study, but I don't think you really know how to study until your life and like your career on the line. You know what I'm saying? Because because like you fail out of dental school, it ain't like you can go to another dental school.
Yeah.
You're not going to another dental school.
I think about something you said earlier, and I don't know how to compare the two yet, but you were saying how like you got your pros and cons to being a coach's son. Like you got pros for maybe relationships, people you can know, meet, and be in rooms with, which is cool. Cons, maybe people like having this depiction of you, like you're supposed to be this, you're supposed to do that, you're supposed to act this way, be this way. What you mean you're reading books? Why? You're coach the coach, like go play basketball, whatever.
Yeah.
And I wonder, like, is it the same thing? Whereas, like, when you're told, like, when you're smart all your life, like, you got people that you just know they're smart. Oh, he's smart. He's been on class his whole life. But then people get to college and it's like, you start to question whether you're really smart. Like, were they lying to me all my life? Like, am I really smart?
Yeah. I mean, in dental school, not in my class, but we had some other classes where there were guys and girls, they were already pharmacists. Some of them were already finished med school. They were already lawyers. So they were like, they had a different kind of experience on what it meant to really work hard and study. And some of them had families, so like they go on that dental school like a different way. You know what I mean? Like they mommy and daddy at home. So whatever they do in here, they got to get it right now.
Right.
They don't have time to go home and study and do all this other stuff like that. So they got to maximize their time and be efficient. So they have a different urgency, I would say.
Yeah. What was it like completing dental school? Like, what was that feeling like? Because you did 4 years, right?
Right.
4 long years, mind you.
Yeah.
What was it like that semester going into, it's your final semester
Right.
and then completing? Like, talk about that a little bit.
I mean, it felt great. It was like, because really, it's 4 years, but when you really break it down in like semesters and all that stuff, it's really more than that because you go all year round. You go fall, spring, and summer. The only summer you get off is your first year. After that, it's fall, spring, summer, fall, spring, summer. So it's almost like you went to school instead of 4 years, you went to school like 7 years because the
Yeah.
extra semester during the summertime.
Gotcha.
And it felt great, and it felt, like you really accomplished something. You know what I mean? Like, it's something that I had been thinking about since I was 14, 15, 16 years old that I, completed at 26. So now it's like I felt like it was an opportunity for me to really reflect on what I did, but not be like stuck in it. You know what I'm saying? Like, there's
Yeah.
more to be accomplished, there's more to do, from that.
How'd your parents feel?
I think they were elated. I mean, they were happy. They got a son. They graduated dental school. He's Dr. Thomas now. And I think they felt like all their sacrifices that they did beforehand, really helped pay the way. Whether that was, my mom working 2 jobs, my
Yeah.
dad, making us do all this crazy stuff we feel like at the time. I think I think they felt good about it.
And I know we didn't speak on it too heavy, but like just being younger and being a Thompson and living with your dad at the time, a lot of stuff that you didn't understand at that time. Do y'all have conversations now like thank you for that, or like I understood why you did that now?
Yeah, because I think when I talked to him about my 2 sons, I kind of make them do some of the same stuff. Like,
Okay.
on the weekend, we're not just playing the tablet and all that. Like, no, they doing work. It might not be, for hours or whatever because they're young, but they getting 15 to 30 minutes of like some sort of educational stuff every weekend. And, they got a limit on tablets and stuff like that, which right now they probably think is like crazy. But it's all the same stuff that he was doing with me and us that I'm kind of doing with them as well.
Right.
So, but yeah, I think from that, I think he feels that there's some appreciation for it. I think probably the greatest thing that my dad does, not only like as a father, but even as a coach, is really tapping into who you are and making you believe that you can be a lot better than that.
Mm.
So like, to me, his greatest attribute as a coach is making you believe you should be better than what your skill set probably think that you should be.
Mm.
Really like making you think you're supposed to be a dog, making you think you're supposed to score 20 points, making you think you're supposed to hit 40% of your threes or whatever. Even though in conventional thinking, somebody would probably say, nah, he shouldn't be doing it, but he would make you think that.
Yeah.
And I think it's part of a motivational kind of just pushing you.
Yeah,
that
that's
he
that's
has.
super empowering though. You know
Yeah.
what I'm saying? You need
Yeah.
that sometimes.
Yeah.
Because you doubt yourself.
Yeah.
So imagine a coach telling you, you could do it. You
Right.
can do it. You know what I'm saying? I'm gonna
Right.
go out there and do it.
Yeah.
So I
Yeah.
like that. So after dental school, 'cause I think just for me and people, after talking to certain people, I know that's not the case now, but when I hear about somebody being a dentist, I think, okay, they went to dental school, then boom, whatever their name is, dentistry, right? That's what I think.
Mm-hmm.
But I know that's not the process.
Mm-hmm.
So after dental school, what's after that?
For me or just anybody?
But you.
Okay. So for me, I did a GPR, which is a general practice residency, which is
That was in the Bronx.
that was in the Bronx. So I did my GPR at Bronx Lebanon Hospital. And that's an opportunity for you after you finish dental school to get more training, to basically get more reps in. Or if you want, after dental school, you can go ahead and practice. You can go ahead and be a dentist and working on real patients and stuff like that. Or you can go specialize. So it's a couple different avenues after dental school. You can go ahead and just work. You can go get special training in being a general dentist, or you can go specialize, meaning you can go be a pediatric dentist, which is like a kid dentist. You can be a periodontist, which is like a gum specialist. You can be an oral surgeon, someone that helps with traumatic events or wisdom teeth or implants and that kind of thing. You can be what we call an endodontist, which is someone that does basically root canals, or you can do an orthodontist, individuals that do basically braces.
All right, hold on, real quick. I got lost for a second. So sometimes when you go to the dentist, is that why you got multiple people like within that dentistry? Because
Right.
everybody might do something different.
Everybody might do something different. Everybody might be a specialist. So there are some group practices where, okay, they have a general dentist, but then they might have an orthodontist there as well. Or they might have an oral surgeon there as well. So there's different avenues that you can go into with dentistry in similar ways to like medicine. So medicine, you got your general family practitioners, but then you got your orthopedic surgeons that help with like athletes or, injuries or whatever the case may be. And then you got like your endocrinologists and all those different things like that. So there are different specialties in dentistry.
This is out of curiosity. I'm just asking. After dental school, do you think someone, not that'd be the end goal, but what if someone went and worked in urgent care? Would that be something somebody would do or no?
So there is like a specialty for that, emergency dental. But for the most part, you do a lot of general dentistry procedures, but you can kind of cater to more like emergency situations.
Okay, I only asked that question. Now that you say that, I feel like I felt bad now because I went to urgent care years ago, and I had a toothache or whatever. So it's Sunday, you can't go nowhere else. So I went
Right.
there, and I could tell he knew he was doing because I left it. I wasn't in pain anymore, but he gave me some. I don't know what it was called, Licodeine. I don't know something. I don't know what it was, but whatever it was, I was good.
Okay.
Right, and I remember like years later, whatever, going to that same one, like, oh, like, cool, I'm gonna go here, I'm gonna get this, get
Yeah.
this little shot, whatever he did last time, whatever he did.
Yeah.
And she was like, oh, no, I don't know how to do none of that stuff. I was like,
Oh.
why not? Like,
Okay.
the guy did it a couple years ago.
Yeah.
But now listening to you talk, I feel bad. 'Cause I just thought she knew what she was doing.
Yeah.
But that probably wasn't her field. He probably just knew more in that field so he can do
probably-
more.
Yeah. He might have been.
I got
like-
lucky
Yeah.
at urgent care, which is, odd.
Yeah.
But dang, I feel bad now.
He probably was like an urgent care, MD medical doctor, and
Right,
maybe
right.
he got some different experiences in that, and he might have said, okay, let me give him a lidocaine shot or whatever,
Yeah.
to numb the pain so he can get somewhere on Monday or Tuesday or whatever. the
Yeah,
case may
he
be.
took some fluid out or something, and
Yeah.
that took a lot of pressure off my jaw. And then
Yeah.
he did something else. He's
Yeah.
like, you should be good. But I could just tell he knew dental work. But I guess now listening to you talk,
Mhm.
I didn't realize how many different avenues it was in
Yeah.
dentistry or just after dental school. I'm
Yeah.
thinking y'all all do the same thing,
Right.
but that's not the case.
Yeah.
So with you said it's PGR,
GPR.
GPR. Jesus Christ, look at me thinking about golf. All right, what did you specialize in? Like, what was your area? What is your area?
So in the GPR, basically you do the Bronx Lebanon Hospital. They're known for emergency situations, wisdom teeth, and root canal exposure. So basically, with each GPR around the country, they have a different kind of skill set that they now I'm not gonna say specialize in, but they say they can give you special training in.
Gotcha.
Along with implants there as well too. So that's what we did a lot of, even on our patients that we saw in the clinic. But not only in the clinic, we saw a lot of patients after hours because we were also on call. So any patients that came through to the hospital that had any kind of issues above the neck, they would call the GPR resident that was on call. So you would go in at 2 a.m. or 4 a.m., whatever it is, you have a phone, and they would call and say, hey, we got a patient on this floor, whatever. You go see them and diagnose and kind of see what's going on with the patient. But in the actual program, we did a lot of root canals, wisdom teeth extractions, implants, and kind of handling emergency situations.
So it's on a tangent, but where'd you stay in the Bronx? Like when you
I stayed in Manhattan. I stayed off of
smart man.
I stayed off of it was 135th and Broadway. So I was staying in this huge building called 3333, and it was 10 blocks above Harlem, which is 125.
Yeah.
But it was more so the west side, so you can see the Hudson River. You can see like New Jersey, Hoboken, and all that stuff across the river. And that was a great experience as well too.
Yeah. You ever visit Harlem?
Yeah.
How'd you like it?
It was good. It was great.
Harlem's
you see the
fun.
Apollo.
Yeah.
They got a lot of cool Jamaican spots, fried chicken spots,
Yeah.
and then Spanish Harlem is cool too.
I was gonna say you
Yeah.
go to Spanish Harlem.
Spanish Harlem, that's where it's at. That's where it's at.
I love
That's where it's
Spanish
at.
food, by the way,
Yeah.
so that's always my favorite. But Harlem is amazing. Manhattan's amazing too.
Yeah.
I think Manhattan got the best pizza because they got the
Yeah.
real Italians in Manhattan.
Yeah.
But yeah, the food is amazing in New York. I
Yeah.
will say that it's amazing.
Yeah.
Being from like here and then also living out there, what do you think about like, they say New York is the city that never sleeps,
Yeah.
but then you got food places open at 2 in the morning, 1 in the morning. Like
Yep.
it's the same food you can get in the afternoon.
Right. I mean, that's the beauty of New York. Everything is open. I remember going to like one night I got off on call early because somebody else was gonna finish it up, and I said, "Man, I need some shoes." So I went to like Foot Locker. It was like 2 a.m. Man, and got some shoes just because it was a weekend or whatever, and I was like, "Okay, let me just go ahead and get them now. I'll sleep in tomorrow." But I went and got some shoes at like 2 a.m. in Foot Locker. But New York is great. The Chinese food up there is really amazing.
I love it.
And the fact that they deliver like that is
But they're still
amazing.
doing it on bikes when you
on bikes. Yep. You see the Chinese guy on bikes, snow, rain, sleet, whatever, man. Your sesame chicken gonna be there and it's gonna be hot.
I feel like they had Uber before Uber was Uber.
They
Just
did.
on bikes, you know what I'm saying?
They did.
Oh, that's funny. Pizza too. But after your training in the Bronx, so where that land you after that?
So I came back to Atlanta and worked in private practice for a year. So I worked with this guy named Dr. Jason Eaglin. And it was a cool experience. He had 4 different offices. One was in Fayetteville, Jonesboro, Midtown, and Johns Creek. And we would kind of split time between the 4 different offices. And it was a good experience for me. I learned a lot from him. But just like long term, I feel like it wasn't for me. I feel like it was just
Can I ask
It's
what's
too
the
much.
difference between like you said private? So is it a public one and private one? What's the difference between the two?
so you have like a private dental office, meaning like there's one owner or a group of owners that are not affiliated with a larger conglomerate like a Coast Dental or Aspen or Great Expressions or Mint Dentistry or something like that. So those are what we call like chain dental offices or what they call a DSO, like a dental service organization, which is like just a big group. Then you got the private offices that are like Dr. Taiwan Williams or like myself that are privately owned by one person that makes all the decisions. And then you have like, there are some dental offices like public health that you can go to like at the health department or something like that.
Got you.
Yeah.
You mentioned Ty.
Mm-hmm.
Speak about him a little bit because he spoke about you when I saw him.
Yeah.
And he was mentioned on a podcast with PJ Ware, who owns Kitchen Kings in Augusta, Georgia.
Mm-hmm.
And PJ was saying like, coming up, I didn't have that. I didn't have a him to say it's another way to make it outside what I was doing.
Right.
He said it was 2 ways, and that was sports, and what he thought at the time was drugs. I was gonna make it out with that.
Yeah.
And so he gambled with that. What was your experience like with Dr. Ty?
So my experience with him, man, is great and always has been great. So as far as dentistry and dental school, so my kind of first introductions to that was 1, Dr. Picard, which was in Thompson, and then 2, my cousin who had graduated in dental school like in 99 or 2000, but he was much older, so I didn't really I had a relationship with him, but not like that.
Yeah.
But Taiwan was somebody that kind of filled that void. He's like a big brother, you know what I mean? Like, and he a straight shooter. He gonna tell you, what it is and stuff like that. Because I remember the first time I met him, I was talking to him about going to dental school, whatever, and he was like, "Man, you gotta do this, this, and this." And whatever. And I remember the first time I took the DAT in like March of like 2008 or something like that. But I didn't do that well. And I told him what my scores were. He said, "You gotta do better than that, Jack." But that's him though. And I didn't take offense to it. I was like, okay, he telling me the real. You know what I mean? Like, I don't want to talk to somebody and say, "Oh, you can get it next time." Like, no, he said, "You gotta do better than that, Jack." He said, "This is what you need to do, whatever." And he went to pain as well. So when I went to Payne in 2005. I think he had finished at Payne in 2004. So when I was going to Payne, I think he was either already a first year dental student. I think, yeah, because I think he finished in 2008, if I'm not mistaken. So he was a first year dental student at MCG when I, or maybe he was a second year. But anyway, we kind of a year or two off or whatever. But when I was going to Payne, he was like somebody that I think the Payne instructors, the science instructors, like once you tell them what you're trying to do, and I was showing them in my grades and stuff, like, okay, he can probably really do it. He need to talk to Taiwan. So I got hooked up with him, and the relationship kind of been growing since then. And he's like a big brother. He's somebody, like I said, he's a straight shooter, man. He's gonna tell you like it is, and that's how you want your big brother to be,
Right,
you know.
right.
And I think that's something that I had privy to that maybe some other people didn't. I had somebody that was actually in dental school that I knew that went to the same college I went to and had some of the same experiences that I had, that I can call and talk to about dental school.
Yeah, man. Clap it up for him, man. It's dope, man. I gotta get him on. I'm probably gonna hit him up this week, more than likely.
Yeah.
I'm trying to got all the medical ones back to back if I could.
Yeah.
I also feel like people are gonna see yours, and then I might get some followers from the medical field, and then that's how it normally works anyway.
Right.
So we'll see.
The interesting thing about Taiwan is, you know, he was a DJ too.
I heard.
And I'm pretty sure he still does DJ from time to time.
That's what I heard. During somebody on a post about him when I put that clip out, they said that on there.
Yeah.
So ask about these tapes. Ask him about that. So
Yeah.
shout out to DJ Doctor, DJ Doctor Taiwan.
Yeah, man.
Shout out to him. Okay, so you moved to, you come to Atlanta. You're doing some private practices. What kind of gamble, risk, or if that's not the next step, I don't know. Like we in Marietta Smile Gallery.
Mm-hmm.
How does this formulate? Is this something that just came about? How long you been doing it? I see a lot of awards over there. I feel like every year.
Yeah, we trying to get every year, man. Every year. So after I left the private office, I worked at a corporation, Coach Dental, for like, I did that for like, it was 2015, 14. So I did that for like 5 years. And as I kind of matriculated through Coast, I started to get, like, my skill set started to get better. I started taking a lot more, you know, I was taking a lot of classes, a lot of CE courses, learning a lot, got a fellowship award and all that kind of stuff like that. And I kind of always wanted my own practice in my own office, but I just needed to figure out the timing and the location. So basically, I started kind of thinking and praying about it because it's a big decision. You're leaving the comfort zone of a dental service organization that does everything for you besides the dentistry. All I did was the dentistry part. I didn't pay anybody. I didn't hire anybody. I didn't do any interviews. I didn't do any ordering of equipment or anything like that. So I prayed about it and one thing I did do was a demographic study, which is something that you'll do when you're trying to open up a business and see what the need is for that particular business. So in the demographic study that I did, it came up with, you know, Cobb County, Gwinnett County, and I think like Alpharetta and some other places. But some of those places were a little bit outside of the radius I want to be. I still want to be kind of close to the city, but not too close. And I kind of stumbled upon Marietta or East Cobb, as some people call it. And I found a practice, and we basically kind of, you know, made an offer on it, that kind of thing. So,
but like, I guess I know it's a lot of money that goes into that as well. So like, is this something you have to partner up with somebody? Is it just solely you doing it? Like, what steps do you have to take in order to even get, like, I guess, say the building, then let's say, you know, insurance, all this kind of stuff. Like, what kind of steps go into making sure those things are there?
Okay, so the first step is forming an LLC, which is simple. It doesn't take much. Basically, you can form an LLC with the federal, like, you get an EIN number, and then you help formulate that with the state. And the second thing would be to like find your location where you want to be. And then that may or may not change the name that you want, because initially I was Atlanta Smile Gallery, but then I changed to Marietta Smile Gallery just because we're here in Marietta. Um, so that's kind of what you have to have first. And then obviously you got to have the credentials and stuff like that. But then as far as like the bank and all the other kind of stuff like that, you really, to buy a dental office, you don't have to show like a whole bunch of like, they just got to know you got a stable income from being a dentist already. And what your plan is for the office. They're gonna provide you with the necessary money to kind of build it up, and then you just pay them back. But that part really wasn't the hard part. The hard part about dentistry is not the dental part or the business part. It's more so of handling people and handling employees and all that.
But you're a people person. It seemed like.
Yeah, but people are not like they're not. People aren't nice. People don't do the right thing. Like you can't control them. Like I can control the dentistry that I do. I can control the decisions that I make as far as business wise. I can't control how somebody doesn't want to come in today, or somebody doesn't. You know what I mean? Like I can't control that. I can control my actions and how I am with my patients, but I can't control the other uncontrollables, I would say.
I got you. That makes sense. So just like the feeling of having your own practice, like what's some of the perks of that? Because I know people automatically think money, but I'm sure it's more perks than just that, because you also got bills you have to dish out.
Right.
What's some of the perks of like just being yours?
The perks are, man, like, I mean, sense of ownership, sense of appreciation for some of the things that you've done to get here, the sense of the ability to make your own decisions to practice how you want to practice. Whereas sometimes with a dental service organization, sometimes you might not have that privilege to do some of those things. You might have to just do how they done things all along, meaning like, for example, you might have to see a gazillion patients a day just because that's the way they function. But that's not really the way that I function. I like to function as far as giving patients that quality time so I can do quality work. And, a lot of times patients are coming in with fears and stuff already. They're either scared or they have some kind of traumatic event initially. So my goal is to try to make that experience the best experience that it can be in an efficient time. Whereas maybe the dental service organization and chain, they don't really care about that. They're just trying to get the patients in and get them out.
I was going to ask you that, like, what do you think, if you had to tell somebody the experience they get when they come here, what's that like? What's the experience like at Marietta Smile Gallery?
I would say it's a relationship building experience. So I try to build relationships with the patients, and not necessarily something where we got to be buddy buddy or nothing like that, but more so that you feel comfortable. And I think once you as a patient feel a certain level of comfort, I think then that becomes a relationship where there's trust being built. So the experience is going to be one that you're going to feel comfortable here. You're going to feel listened to. You're going to feel like we are adhering to the things that you're concerned about, and that we're making you better. We're making your smile better. We're making you healthier. We're giving you tips that you can use for a lifetime. We're helping you, take care of your teeth and your mouth, for forever. We're not just doing this for today. We're trying to give you tips and stuff to help you continue on.
And that's dope too. I want to ask, because I gotta ask, because I see him over there. What was your feeling like when you first won any of those awards? Like the first time you won it, did you expect it? Did you work for that? Like, how does that work?
Well, actually, I think the first one that we won, I didn't even know we were nominated. Now the guy, so Best Self is a magazine here in Atlanta, and they do digital marketing, and they have a physical paper copy as well too. So the first year that we won, I didn't even know we were nominated. The guy that is over it said he emailed us and said, "Hey, you guys are nominated. should tell your patients to go online and vote, this and that, whatever. I didn't even know we were nominated because when he sent the email, he said he misspelled Marietta somehow. Like the email kept bouncing back. But like the voting started like the next day or whatever the case may be, and then we actually won. So when he came and told us and said we won, I was like, well, we didn't know it was a competition. He said, oh, well, I tried to email you, whatever. He said, but the email bounced back, and then he said, I think one went through, whatever. So somehow we won. So basically what happened was patients that received their information from that particular website or magazine, they went online and voted themselves without us even like sending out an email blast, hey, vote for us for this or that. So that was the first one. So that one I was really like surprised and stunned because it wasn't something like that I even tried to promote. It just happened organically.
You're doing good work. You got rewarded.
Yeah.
No pun intended.
Yeah. I mean, that's a lot of times, that's sometimes in some way, that's how life works.
Yeah.
Not to go off, but like there's a book that I read called The Compound Effect. You ever heard of that before?
Mm-mm.
It's I think it's about this guy named Darren Hardy or Hardin. But basically it talks about the compound effect of making good decisions. Like if you make good decisions or good habits over and over and over and over again, the end result is it can't be anything but good or great. Like you can't have nothing but success from that. And I think that's something that spoke volumes of that as well too. Like all we did was just try to treat our patients well and do what's best for them. And in some ways, those small habits that we did every single day, taking the time to explain treatment to patients, taking time to talk to patients' moms or their significant others about, okay, this is what I think is best for them. And I think that is kind of what laid the foundation to some of that success as well.
I'm looking at what years we see over there? Because I see 2021, 22,
and then we just got one for 25.
What year is that over there? I can't.
23.
Okay, you in the way, so
Yeah.
he got a book with the smile on it. You know what I'm saying? Shout out to him. Okay. So wow. Okay, that's a lot.
Yeah.
That's a lot.
Yeah.
And it's different stuff. It says best general practice. I got best general practice, best cosmetic.
Yeah.
And I also see even on your Instagram, you have maybe because it's Marietta. I don't know if it's because it's you. I don't know. But you have stars that come here and see you as well.
Yeah.
What's that like? Are you knowing they're coming in? Do you see them like, oh, that's such and such? Like, how's that like?
Well, some of them, a great deal of them I do know they're coming in, but then some of them I don't. Some of them, that play like in the NFL or some of the Atlanta Housewives or people like that, they just call and make an appointment like a normal person. Some of the stars I have a relationship either with them or some of them like maybe they're moving from LA to Atlanta and their LA doctor may hit me up on Instagram or they might already have my number already and say, hey, such and such is moving. I'm referring them to you. You can take care of them. This is what we've been working on. This is what we got next. Or, or I got a patient in Atlanta. They got a show tonight, but they got an emergency situation. Can you see them today? So a lot of it's built on prior relationships with other dentists as well.
You don't watch Housewives?
Yeah.
Oh, okay.
Yeah.
I thought you said you ain't know you seen when they came in. But I said I'll be watching a little something.
No, I'm saying like they don't hit me
themselves
up.
like I'm from such and such. I'm coming to you.
Or they don't hit me up and say, hey, I want to come in, like on Instagram. And they just get on this. You come in or my office manager say, hey, such and such is coming next Thursday or whatever. I'm like, oh, is that? They're like, yeah, that's such.
I see you had Drewski.
Yeah.
You got the Migos here. I call them the Migos. I don't want to say the wrong one because one of them not here no more, so I don't want to say the wrong name. Offset, yeah. What was that like? Because even as a rapper, they do a lot of stuff with their teeth, whether they bling it out or whatever.
Yeah.
It's like, what does it feel like when you have someone like a rapper come in, and do you feel like you have to be extra careful, or is it like most of publicity? Is it word of mouth?
Yeah. I mean, with them, no, because I mean, we take care of all our patients. We treat all of our patients the same. Now, obviously, it's um different people. They are interested in different things. So, maybe someone is just interested in like normal cleanings and stuff like that. Whereas, somebody like Offset or Drewski or whomever the case may be, they may be more interested in veneers, or they may want a diamond, or Lil Uzi Vert might want this or whatever the case may be. So you try to accommodate them on where they're trying to go with what they're trying to do, but also within the realm of doing really really good dentistry.
Yeah, I saw, and I think that's the dopest thing about what you're saying. Like just treating everybody the same, whether they a star you can take a picture with, or they just
Hmm.
coming in and out.
Hmm.
Um, how when you said private, private just meant like ownership more than anything, right?
Right, right.
Could you do take insurance?
Yes.
Okay.
Yeah.
I don't know why I always thought private meant like you gotta pay out of pocket. Like
Yeah.
if it's private, I don't even
Yeah.
I know I can't pay for it. So
But just because we take insurance don't mean you don't have any out of pocket. You still gotta pay something.
you
Insurance.
said, hold on, real quick.
Insurance is just an allowance. They
Got
just
you.
give you an allowance throughout the year to use, but it's not necessarily something that's going to pay for everything. And we try to make that really clear with our patients and make sure they understand that. So not only are you paying for the services, you're paying for the quality as well.
Got you.
So there are some things that your insurance is not going to cover, but as your dentist, I know that, okay, when I take out this wisdom tooth, I don't need to just take it out. I probably need to put a collagen plug in there too, so you don't get dry socket. Your insurance is not going to pay for the collagen plug or membrane and all this other stuff, but it's going to help you heal faster, and it's going to help you prevent from having issues down the line like a dry socket or something like that. So yes, that may be an extra cost.
It's a lot to just keep your. I know y'all say just brush your teeth, but it's a lot to just keep your teeth like right. This is me. I don't. If I'm wrong, let me know. I just feel like it's more than brushing them. I feel like with time, stuff just gonna mess up too.
Yeah, it's a lot of things that maybe get misconstrued. You know what I mean? But generally, if you brush, if you floss and rinse, and you see a dentist, and at least twice a year, then for the most part you're gonna be healthy. Now, when you get beyond that, or out of those three things you only do one, then you are maybe susceptible to needing more work. The other thing is diet too. A lot of people forget that, man. Diet is everything. It's not just for you to look great and exercise and all that stuff like that, but the diet really affects your mouth. And one thing people don't realize sometimes is that sugar is in a lot of different food items that we really don't pay attention to. Like, for example, I mean, even salad dressing, you can look on the back of it, it'll say what the added sugar is on there.
Yeah,
It'll tell you, but you won't you won't really pay attention to it. Even all the vinaigrettes and stuff, they seem like they're really really healthy and stuff like that, but raspberry vinaigrette, some of them got 12 or 13 grams of added sugar per serving. But when you eat your salad, you might use 2 or 3 servings. So now you got 30, 40 grams of sugar on your salad that you think is healthy, along with the dried craisins or whatever you put in there, the candied walnuts you put in there, which is sugar. So that's something that you got to pay attention to as well. And then even stuff like the protein bars and protein shakes, a lot of them have artificial sugars in there, which is just the same. Bacteria loves the sugar just the same, no matter where it comes from. So basically, that will help cause cavities and all that. So basically, sugar plus bacteria, and it sits on the teeth long enough, it'll mature into decay.
So that's how that happens.
Yeah.
So you eat some, you eat your candy all day or whatever, and then you got bacteria. It's kind of just they just blend in, hugging each other, just chilling,
and then bury a hole into the tooth. And the hole initially starts small, then it grows and grows and grows as long as those habits are continued. But if you change some of those habits, then you can change the overall health of your mouth.
I'm not sure if you want to talk about it now, but you got an event coming up, or I know something you've been promoting. You want to talk about that, or?
Yeah, so we got Invisalign Day coming up on October 24th. And basically, we do a lot of Invisalign here. And Invisalign is, to me, like it's like one of those things where it's like amazing. I've seen it work so many wonders on patients as far as moving their teeth in the correct position, helping eliminate, crowd and space and, restructuring patients' bites and all that kind of stuff like that. And basically, Invisalign is an alternative to braces. So most people, when they think about straightening their teeth, they think about braces. But an alternative to that is Invisalign. And with Invisalign, basically you wear a retainer tray throughout the day, maybe 20 to 22 hours a day, and then you just take it out to eat or whatever, and then you put it back in. And each tray that you wear slowly moves the teeth in the correct position. So, for example, you come in for an exam, we say, okay, you're a good candidate for Invisalign. We use a scanner called an iTero. So there's no ooey gooey impression material that you bite into. We just use a scan and it takes a 3D image of your teeth and we send it to the Invisalign lab. And then myself and the Invisalign doctor, we kind of formulate a plan for you as far as how we should move your teeth. And then Invisalign, they'll print like 30 or so Invisalign trays for you. And each tray you'll wear for maybe, let's just say, a week. So you wear tray 1 for a week, and then you switch to tray 2 and so on and so forth. And as you get to the end, the teeth will be in the correct position that we want them to. So with our Invisalign Day, it's a partnership between our office and Invisalign, and you get the Invisalign treatment itself. You get retainers, you get a whitening kit, and then you get an electronic toothbrush as well too. So that's on October 24th, and you can sign up before then, but basically it's an opportunity for you to take advantage of that deal.
What's the detail? Like, you pay the ticket to get in, or how does that work?
No, you just come in initially for a consult, and we let you know if you're a good candidate for Invisalign or not. And then if you are, then we kind of go over the costs, help you figure out what your insurance will help you with and what your out-of-pocket costs are, and then kind of figure out how to do the other finance part, whether it's something that you pay over monthly, or is it something that you put on what we call Care Credit, and Care Credit is basically like a healthcare credit card.
Okay.
And in fact, some people use it, I think, at the vet for like their animals and stuff too.
That's dope. I ain't got no animals, but that I know that's you animal lover right here, my guy Juanito. So and you said that when you come, you leave with what? What you get? You said a bag of.
So you start initial treatment,
Yeah.
and then you get your trays, and you take your trays home, and
that's the same day.
You'll come back after you start. It'll be like 3 weeks, then we install the trays for you.
Okay.
Yeah.
I think I know somebody with that. Is that, if I'm wrong, let me know. But I feel like they had that on TV years ago. I don't know if it's the same thing or not.
Yeah.
But it was something you put in there, and it's supposed to every day. You supposed to.
Yeah.
I guess maybe it's formed and it's grown. I know somebody with it now. I'm gonna say.
Mm-hmm.
I must think it's that. Do they got bootleg Invisaligns? Like, you know how like somebody starts something and then other people start something different.
Now you might be thinking of like Smile Direct Club, which is like a knockoff of Invisalign, but they recently like went out of business or something.
I'm about to say, nah, she didn't give me knockoff vibes. I think she cared about her teeth pretty well.
Okay. So it's probably Invisalign then.
Yeah. Probably. So, I mean, she took it out and was like, oh, it wasn't nothing major. It wasn't nothing.
She didn't like hide it and go to the bathroom and that. She just took it out in front of you.
Yeah.
I mean, common courtesy is like you on a date with this person. I mean, not to put all your business out there, but I'm just saying, it seemed like she would go to the bathroom.
I wasn't. I wasn't like, at a job. It's just funny because I think she had 8. So that's why I think she had 8 already.
Okay.
Or she must have putting it back in after she ate.
Okay.
I'm thinking. I don't know. Now I gotta
ask. She washed her hands or something. Then.
She did come from the bathroom, so maybe
Okay.
She take that kind of stuff serious.
Okay,
so,
good.
Yeah, because she pretty on the clean side.
Yeah. Okay.
Oh, that's funny though. Yeah, that is funny as hell. Because I don't know now. Now I need to ask, like, was that Invisalign you got in your mouth? But
was it like a? It wasn't a denture or nothing, was it?
No.
Okay.
She got her teeth. Yeah, her teeth is okay. I don't know what she got going on. I don't think she needed it, but she wanted it. So
I mean, I just had to ask.
No, it's decent. Her teeth decent. Okay. It ain't like, man, I don't want to joke about your teeth now. You know what I'm saying? But it ain't. You know what I'm saying? It ain't like that.
Okay.
Without it was fine for the most part.
Right.
Yeah. So okay, and they said that's the 24th of October, and that's here.
Yeah, here.
At your office or here?
At the office, yeah.
Oh, okay. Well, okay. I said that makes sense now. Yeah. I do got a question. I know we're gonna close in a second. I want to just ask you, we talk about a lot just your journey here,
Mhm.
and then you got a wealth of knowledge. So I feel
Mhm.
like even in pockets where we wasn't talk about dentistry, you was able to still talk about dentistry in some way, shape, or form.
Mhm.
But what do you tell, or what could you tell, younger kids like from Thompson,
Mhm.
from Augusta,
Mhm.
from anywhere that's like us, and
Mhm.
maybe they feel like, well, I gotta go the sport route
Mhm.
or whatever. We got this dumb thing where we think it gotta be sports,
Yeah.
rapping, or drugs, which is
Right.
insane. I don't know where we
Yeah.
come with that at, right? It don't gotta be either one of them. But
Right.
what do you what can you say to someone who like wants to be successful,
Mhm.
um, but maybe this being a doctor, being a lawyer hasn't been something that's been put on their table. It haven't
Mhm.
been something they've seen. I
Mhm.
think we want to be basketball players and sports players and rappers because we see it on TV.
Mhm.
We see the games. We see
Mhm.
people go to college and D1, all this stuff.
Right.
We don't really see too many doctors or dentists, come and say, "Hey, this is what I do. I'm from here.
Right.
I live over here. This is how I live." Da da da. What can you say to someone who needs that or doesn't get to see that kind of motivation?
Yeah, I would say, you know, from the kid standpoint, just try to think beyond that. Just in case you have some sort of catastrophic injury or something like that where you can't do that. So try to think beyond um the sports element, rapping element, or drugs or whatever the case may be. Just try to think beyond that and try to find something that interests you, because whatever interests you is instilled in you and interests you because it may be your gift already. So
Mm,
like, um, try to find what that gift is that you have and tap into that. So some people's gift may be painting or drawing, but they may not know any artists or whomever. So try to find somebody in that field or get some kind of develop some sort of relationship with some sort of mentor. I think mentorship is probably the most important thing. If you can find somebody in a field that you like, then you can get some guidance from them. If you're interested in something but you don't have a mentor, you got to go find somebody that's already in that field,
mhm.
because that way you won't have any GPS to get there without some sort of guidance from somebody else. And you know, as far as like parents, try to expose your kids to different things, like um, whether that's different activities or different events. I mean, I see events quite often about health fairs and this and that. That's a perfect opportunity for your son or daughter to go talk to a nurse or whomever
Mhm.
the case may be, because somebody's going to be there that can, if they can't help you, they can get you to somebody that can.
Yeah.
And I think that is something that sometimes is overlooked, is the exposure aspect of it. So sometimes as a kid or a young person, you really can't see that, but you have to be exposed to it. And the way you're exposed to it is by people that are, your parents or whomever's nurturing or taking care of you. So I would probably put more emphasis on exposure than those individuals being thinking about that, because as a kid it's hard for you to think about that if you're not exposed to it.
Right. Right. Right.
But if you are a parent, try to expose your kid to different things and different aspects beyond sports and basketball practice and all this other stuff like that. And really emphasize it. Emphasize reading, emphasize school, emphasize making good grades. And not only just talking about it, but actually putting action for that. So how do you put action towards that? Make your kid read, or take them to book fairs or science fairs or stuff like that, so they can get different perspectives on things.
Nah, I clap it up for you, man. That was amazing. I like that answer. I do think the exposure part is definitely needed. Um, but well, I guess I asked you, like, have you or do you do any kind of like mentorship kind of work? And how do people get in contact with you if needed?
So yeah, we do a lot of mentorship work, man, or I would say I do. I mean, I've had, since I graduated dental school in 2013, I probably have had 14 or 15 students that have come and shadow me. Um, and I think about 9 of them have completed school, and I think the other 6 or so are either they're finishing this year, or some of them are in school, or they like getting ready to apply. And right now we got about, I think I have about I have 3 students shadowing me right now. I have about 4 students that are applying and getting ready to go to dental school. And I got like 2 of them that's starting next year or whatever the case may be. So, and I got a few of them that are in school and about to graduate. So the best way is most of them reach out to me like on Instagram,
Mhm.
or they'll email me through the office email. And I don't just pick everybody, because to be honest with you, man, like
You can't.
you can't, you
Yeah.
know what I mean? And it's not based on this or based on that. It's just more so of if somebody has a relationship with me already, or if it's somebody's son or daughter, if it's somebody like, oh, that came and shadowed me like 4 years ago, they're in dental school, but they got a little sister or something. Okay, you know what I'm saying? So, but it's all about me trying to construct my time, because I would hate for somebody to come and say, I ain't learned nothing.
Yeah.
You know what I'm saying?
Yeah.
So I try to get it to where the students can come, and then I can take a few minutes here and there throughout the day and show them like, okay, this is what we're doing right here. This is what I'm doing right here. This is how we do this. This is what, it is. Okay, look at this picture. Look at this x-ray. And it's really taking time out of my day to show them that kind of things. And I'm busy. So it has to make sense,
Yeah.
for me. So
Nah, that's dope, man. That's dope. I definitely appreciate you. I appreciate the conversation. I appreciate you giving me a journey. I think it's amazing, inspiring, to say the least.
I appreciate it, man. Thank you.
Yeah, I want to say, man, I want to make sure anybody that get to this level know I did drive here for this interview. I don't do that very often. You know what I'm saying? I woke up at 6 in the morning. I said, "Me get on this road, man. Me go." I was gonna come last night, but I had to work and there's a lot of other stuff going on.
Yeah.
But yeah, I knew I wanted to do this, and I knew that I wanted to represent just not only necessarily Augusta Thompson, but just your line of work, your field of work the right way.
Right.
And I got this thing I like to do themes. So my
Right.
theme I want to have a medical. I want my people on my page and go to playlist.
Right.
You got sports, you might have
Yeah.
arts, dental field, like a medical field. I want to have all that stuff. So if people want to say, well, what in Augusta, what from the Masters, Mortimer, whatever, is medical.
Mhm.
Now you got all these people in
Mhm.
medical. That's how I wanted to be, for me and what I like. So I was willing to drive here. I would have caught you in Thompson. I wouldn't have cared. Your kids' baseball games, I would have pulled up to the baseball games with a lavalier mic. It wouldn't have mattered. But I definitely appreciate you, and I want to definitely give you a kudos and your claps again, man. Thank you a lot, man. All right, man. Morning Masters podcast, we out. Thompson is in the building.
Always.
See. It's only a little extra. All right, man.